Saine, Omaye Maudem Rifa.
If you are the money quo,
Omaye Maudem Rifa.
Saine, yes, money quo,
Omaye Maudem Rifa.
Yamifa, yes, money quo,
Omaye Maudem Rifa.
Yabani Timira, money quo,
Omaye Maudem Rifa.
As a priest, I tried each day to live the gospel. And I see my ministry not for myself, but to give myself out to help other people as Christ did.
You know, people here in Ghana, we are in need of so many things. Monsieur Simon Asamoah, he's a good guy and he has a lot of vision in mind, a lot of vision that he wants to help his people.
The first time I came to Ghana, I came on a short-term mission. That was about 10 days with several other doctors and nurses. I just don't feel like there's a lot of dignity in having this little tiny brief opportunity to see a doctor.
So after 10 days, the missionary went back, but Gabriela came back.
I tried to establish a protocol that allowed a short-term mission to test every child for malaria.
It was during that time that I had some discussions with her that can we do something permanent here in Ghana? And she said, I've also been thinking of that.
What we need to do is look at the people who have no hope of getting to a hospital. And it should be good to provide clinics for these people, and we could staff them. And we could do some basic emergency treatment and everything like that. And this is what has led to the whole idea of the clinic.
Monsignor Simon selected Uwabra for this clinic because I think he felt there was clearly a lot of need in the area. It's a poor area, and because of that, there's no preventive care. People only go to the hospital pretty much if they're dying.
Healthcare is far from the people, far away from the people. In this sense, very, very minute diseases can even kill.
We have a lot of kids, children under 5. So some of these kids are dying. They are dying almost and every day. They are dying. But because you don't have clinic nearby, because they are far away, when they are attacked by the disease, they have nothing to save their lives. They just die.
The sheer numbers of people that show up when you hold clinic, especially in a village that doesn't have other local access to healthcare, it's just overwhelming. There's hundreds of people there before we even arrive.
The first day we saw 100 people, and the second day we saw 209 people, which seems like a big number, 309 people in 2 days, but seeing the number of people that were still there at the end of the day, it was very, very difficult to not be able to help when we knew they had walked and been there for 12 hours waiting.
What I tell them to do is put the drop in with their eyes closed and then open their eyes, and it'll go in.
Over there, they don't have a clinic, and so if a clinic is set up for them for a period of time, you realize that we're not going to be there forever. And so at the point that we're leaving, it was like a job that was uncompleted, but we were working with time, so we had to go.
There was one young man that came in. I'm really not sure how old he was. It was hard to tell because he was grossly disfigured from some sort of a disease. We're not sure what the original cause of the disease was. We chose to take him to one of the local hospitals, take the young man and his mother. And really the prognosis didn't look good for this young fella. And this is something that if we had a permanent clinic and he could come and see a nurse, they could have caught that early on and made a difference.
The meaning of Yonkofa is friendship, and so we've termed the project the Friendship Project. And we felt that was important because it truly is a partnership and an interaction between both the foreign doctors and the local community and the local doctors and nurses.
A name for the project, we say Yonkofa. That means we are becoming friends. We are embracing each other. When we went to Iwabra and Kwanta, you see how the chief and the elders came to meet us. And then we went to the site. They donated the land. They were happy that they are also giving us something. They are not like passive recipients. By giving out the land freely, they want to be also stakeholders of the project. They want to be part of the project.
What these people see in the medical clinic is they will see nurses and doctors and medical staff. And what it does is it inspires them.
The clinic in Uwabra would provide a pretty critical element of keeping educated people in their communities instead of drawing them out into the large cities.
Working at the villages is very important because in Ghana here, those are the interior villages don't have access to health. So if you are posted to the villages, you help the people around the village to know more about their health, to know how to take in good food, good drinking water, take care of themselves so that they will not get any sickness.
If we're able to establish a permanent clinic with local nurses that actually live on site, we'll have a medical record. We'll know when the children have been immunized. They can come when they're not acutely ill, when they're not on the verge of dying.
I was a global arts major, so I had a background in music, and I thought, how could I generate revenue to build a clinic? So I got the idea to write music to the mass and sell the CDs to help fund the clinic. I had a good friend who's also a composer, and we collaborated on it.
The Mass, also titled the Yonkofa Project, is a work in progress still. It was always important that we kept a Ghanaian element to whatever the finished product was. We see what a rich musical culture Ghana has to offer. Their drums, their singers, their harmonies. It's all so beautiful, and we really want to capture that.
We're going to be making a CD out of all of the music that we've recorded while we've been here, which is both the Mass that Gabriella and Taylor have written, and also some of the music that the local choirs already knew. The CD is both sort of a cultural exchange and a gesture of friendship and unity.
They recorded a second CD of the youth choir, and then we'll return when the Ghanaians are finished rehearsing the Mass to record that album as well. So we'll have 2 albums.
As good friends, you give, and I also give. Friends share, and that will be the spirit of this project.
So if you can reach out, you can reach out with your funds, you can reach out with your dollar, so that at the end of the day, the Yonkofa that we have put together, you are helping it in a different way that will bring smiles to the people and reassurance.
God bless Gabriel, and we want people like Gabriel, doctors like Gabriel, nurses like Gabriel to come down and help our people here.
I hope to come back and see the clinic operating with just a few patients a day, not a mob. And that way we'll know that the people are coming as they need treatment.
I'm trying to ask you to invest your money, not that you're going to get dollars back, but that when you're about to leave this world, you can say, I have really made it better for other people.
And this project has progressed to the point that I think everybody believes that we're serious and we're definitely intending to do this. And the Ghanaians have contributed so much to it already.
I'm pleading to people to help this Yonkofa project so that we'll be able to provide good health facility for the people to be strong, have a healthy mind to study, and then they come back to help their community. Thank you.
Yes, Samon Swan. Eradi yes, Samon Swan. If you are the money quo, money quo,